I'm going to introduce the 7 panelists. Everybody should have a copy of the program. It's a wonderful souvenir, and if you don't get a chance to get it, some copies should be available on the way out. And I ask that they'll come up as I introduce them. First, the person who has been really a leader in health and healthcare and done an amazing job for us, and we're glad to have him back with us again. Please welcome to the stage Dr. David Satcher. The founder and Chief Executive Officer of Policy Link. Please welcome to the stage Angela Glover Blackwell. Renowned physician, former head of the National Medical Association, and a great person as well. The president of the Multicultural Primary Care Medical Group and vice president of the W. Montague Cobb National Medical Association Health Institute. Please welcome Dr. Rodney Hood. An amazing professor of epidemiology. He's been working at the University of Pennsylvania and really a trailblazer. Please welcome Dr. Shariki Kumanyika. The other half of a wonderful family, a great doctor, the professor of radiology at Harvard Medical School, and director of the PBCT Neuroimaging Center, Boston Children's Hospital. Please welcome Dr. Tina Young-Poussin. Great friend and someone who's been very active in all the work we've done for many years, and also as a doctor and someone in public health and someone who is very conscious, has written several books about it. She's now with Spencer Stewart, and she's also an adjunct professor of the practice of public health at the Harvard School of Public Health. Please welcome Dr. Deborah Prothero-Stiff. And a woman today with her whole posse here. Aren't there women here from Mothers for Justice and Equality? Please stand. The women who've lost a son or daughter to violence in Boston in the last 2 decades. Please stand, ladies and gentlemen, who have stood strong with Mothers for Justice and Equality. And representing them today is Mona Lisa Smith, the Executive Director of Mothers for Justice and Equality. And finally, a very dear friend and an amazing person who's done so much in this area of health and healthcare. And he is the Norman Professor of Public Health, Professor of African and African American Studies and of Sociology at Harvard University. Please welcome Dr. David R. Williams. And as our panel are about to take their seats, please, once again, those of you who were here, didn't hear, it was fantastic, the legends, the women and men, and only men here today, but the people who set the stage decades ago, and they were on the panel this morning before when we first started the program, with the 4 legends of health and healthcare. Please stand and be acknowledged once again, all 4 of them, please. Keep standing. They're still taking pictures, gentlemen. Keep standing. Come on. Don, you got him? Great. Thank you very much. Appreciate it. And this is a panel discussion, and the hopes is that people will jump in addition to giving their comments about the issue of health and healthcare. We've been toying around with this topic for years, and we could never finish it, and we're going to try to at least cut the toenails of it in some respect by just digging into the very basics of it today. And I wanted to start with Dr. Williams, if you could. Give us a little overview. What is the problem of health of African Americans in the 21st century? What do you see as the issue that we face from your point of view as an expert in public health?
Thank you, Professor Ogletree. Let me just begin by saying what a profound and humbling and inspiring experience it has been to participate in this symposium today. It just is an absolutely rejuvenating experience for the struggle that we still have ahead of us and the work that we have to do. So thank you for organizing this. In terms of the health of African Americans, a national study found that more than half of African Americans were unaware that there were racial disparities in health, which is a striking finding, because if we don't know that there's a problem, there's nothing we will do to be mobilized to address it. Let me give you a couple quick examples of the problem of African American health. Imagine a fully loaded jumbo jet with 265 passengers and crew taking off from Boston Logan Airport this afternoon, and that plane crashing and all passengers and crew dying. 265 people today. And the same thing happens tomorrow with another jet crashing and everybody dying. And the same thing happens every day next week and every day next month and every day for a year. That is the magnitude of what we mean that there are racial disparities in health. There are 265 African Americans dying prematurely every day. Now, Congress would move heaven and earth to find out why a bolt was bolted on wrong on a DC-9 jet. But there is this massive loss of life in the most productive years of life that we are just so laid back about. Give you a couple other quick examples. Today in the United States, a black infant born in the USA is 2.4 times more likely to die before his or her first birthday than a white infant. That's the gap in infant mortality. Give you another example. Researchers have put together this summary measure of biological dysregulation across multiple systems based on 10 physiological indicators. And using national data from the NHANES study, what they're finding is that African Americans are aging 10 years faster than whites. So if we look at the health of whites at 50 years of age, African Americans reach that same level of physiological dysregulation 10 years earlier. So there are another summary indicator would be life expectancy. How long does the average person live? There's still a 5-year gap in life expectancy between African Americans and whites. And maybe let me give you one last example. If you look at the health of African Americans today and the health of whites today, as indicated by overall life expectancy, African Americans today have the health that whites had 30 years ago. And these are all national data that indicate the magnitude of racial disparities in health. And one last point to put it into perspective. In all of the comparisons I have made, I have used whites as the comparison. Whites do not have an optimal level of health. If white America were a country, it would rank 26th in the world on infant mortality, on overall life expectancy. So that there is a challenge that all of us could be doing better in terms of health. But as Jesse Jackson taught us a long time ago, when America gets a cold, black folk get pneumonia. So that we are doing so much worse than whites, but don't think that whites are doing as well as we optimally could do. And we need to find a way to engage the American public and policy leaders to improve the health of all Americans, and certainly to give an extra helping hand to those who are furthest behind.
Thank you so much. Mona Lisa Smith is the executive director of the Mothers for Justice and Equality and brings this home. What's happening in Boston, in Dorchester, Mattapan, and Roxbury today? What's happening in the 21st century with black boys and with families? Mona Lisa?
Thank you. Thank you, Professor Ogletree. So Dr. Williams really made the point, in my opinion, of showing that there's a loss of life, and the loss of life is to an enormity, and we don't think of it the same way as we think of the cure for other things. But the reality is that there's the loss of life, there's those that are left behind, and then there's all of those other symptoms that go along with those that are still left behind. So it starts to perpetuate. So we have today we're facing a crisis of mental illness. We're facing children who are traumatized, and it's going untreated and turning into other types of symptoms. It starts to feed the juvenile justice system, and we are now facing massive incarceration. So all of that is a community that is trying to rise up out of the ashes of losing children to violence and watching their children go to prison, and also being deprived of quality education. So we have all of these factors that are now in place that are happening in our community. And so there is a grassroots movement. People are starting to begin to say that it's not okay. Mothers who have sat silently and watched hopelessly are saying that I can't do this anymore. You know, I got to get up. I have to do something. And history has taught us that when the people begin to internalize and they begin to relate to the problem, that change begins to happen. That's what the civil rights movement was all about. So we're starting to see that, but we need help. You know, we need people who have the knowledge, the skill, the resources to come down to the grassroots level and begin to inspire and encourage us, to let us know that hope lives, and it still lives within us as we keep speaking the truth. You know, we have mothers who have lost 9-year-old sons, and they're fighting the good fight. You know, they've stayed in their homes for 10, 15 years, and they've gotten up and said, I'm going to fight the good fight. I mean, we have mothers who have lost 13-year-old sons, you know, who have walked out their door and their child is laying at their feet, and police officers ask, was it gang related? You know, we're dealing with all of those realities. And then we had Trayvon Martin, which a mother who raises a child, and you know, we all do the right things, but now our reality is that their life could be taken too. And their life, everything that we built our movement on that said we're going to show that our children's lives matter. We're going to show that hope still exists in our kids. We're going to speak truth into the situation. Everything became this situation with Trayvon Martin. But the reality is that we keep fighting the good fight. We are still inspired by one another. And although we're facing epidemic of untreated mental illness, schools that doesn't even want our children to talk about it, girls that have decided to take on, you know, these forms of gang violence. You know, social media that was supposed to be used for the positive is now being used to fuel violence in our community. We're faced with all of this. This is our reality today. But hope still lives within each and every one of us, and we ask for your help.
Thank you so much, Mona Lisa. I'm going to go next to also a non-doctor, Angela Glover Blackwell. Angela is the founder and the amazing work with Policy Link, and she has a new report out. I hope most of you got a copy of it. And it's not the first report. They do one almost every year. And this one's called Why Place and Race Matters, to tell us that even in the 21st century, we're still having problems. Angela, what do you have to say about that?
Plenty. That when we think about health and well-being...
Everybody here?
Can I lift this? Thank you. When we think about health and well-being, it is so important to know that health care, the quality of it and access to it, that's just a little bit of what contributes to real health. A lot of it comes from genetics, behavior, and environment, and behavior is closely tied to environment. There is something going on in this country in terms of an unholy coming together of race and poverty. And if you live at that intersection, where you live is literally a proxy for how long you will live and the quality and well-being while you live. Not to mention that it's also a proxy for your economic standing, your educational standing, the opportunities to get a job, and many other things. But this notion of where you live and your neighborhood and your community impacting health is not well understood, and we have not done enough about it. That when you think about the behaviors that the medical profession is always telling us about in terms of make sure that you eat a healthy diet and you get a lot of exercise. Imagine going to the doctor and the doctor says the thing that you really need is a healthy diet and exercise. And you go back to a community where it is impossible to find a tomato. You go back to a community where there are no sidewalks, where the sidewalks are not safe to walk on, where the community is not a safe place to play, where the playgrounds are forbidden, where responsible parenting means stay in this house and do not leave unless I am with you, and if I am gone till 10 o'clock at night, you are there all day because it is not safe to go out. We have to begin to understand the impact of the way public policy has made us unhealthy. The way public policy that allows communities to be poor, that does not encourage economic activity, that has schools failing, that allows zoning decisions to decide how we're going to live, that we have to raise this to the policy level and begin to improve our communities so that our health will improve.
Thank you so much. Dr. Rodney Hood, you examined some of these issues of health and decline in health of African Americans particularly, and you're still doing that in the sense of the work that you're doing now. What do you say is our challenge? What should we be doing to address the issues of health and healthcare in the Black community as a doctor?
Well, good afternoon. As Angela said, I have plenty to say, but I'll try and be very brief. I really get my passion from who and what I am and where I came from. And it continues by still seeing patients in an underserved area of San Diego. Before I left, I was talking with a patient of mine by the name of Ruby Mathewson, who's 58, very poor, and very sick. And we were doing a survey as to what the Affordable Care Act would mean and what their understanding was. And so her question to me, after we asked some questions, was, what is the Affordable Care Act going to do for me? And I said, well, probably not that much. You already have insurance, you're covered. You have a physician, me. And she looked at me and said, but I can't afford the care I have. Our problem is not coverage. The majority of the patients and disparities we're talking about have coverage. The problem is the system is not designed to take care of the population that it should be designed to take care of. It's kind of like we've developed a narrative that I think needs to change. And I am very honored to be here because my mentors, Dr. White, Dr. Satcher, Dr. Lewis, and Dr. Poussin, who I've read, learned from. And what Ruby Mathewson was saying was, but what about me? How does all this research and all this knowledge change me to be able to get good quality health care, in spite of the fact that she has coverage? So we heard the statistics on health disparities. I once gave a talk in front of a majority audience, and I quoted Dr. Satcher's statistics where he said 80,000 African Americans lose their life every year because of health disparities. And I said, to me, to quote one of our Supreme Court justices, that's the equivalent to high-tech lynching. And afterwards, one of my white colleagues said, well, Rodney, wasn't that a little bit over the top? I said, tell me why. We're still being lynched. That's how I feel when we have the lowest life expectancy. So the issue really isn't research in the data. The issue is, what are we going to do? And it became humbling as I began to read Angela's work and some of the other social scientists' work, that no matter how good a physician I am, and even if we tripled the number of African American physicians, our people will still be getting terrible care in the current healthcare system. So how do we change that? In other words, Ruby Mathewson is saying, all of this talk is good, Dr. Hood, but what you gonna do? We need to change the narrative. It is, I call it the good, the bad, and the ugly. The ugly is health disparities is unjust and immoral. We've been saying that for decades. Not much has changed. The bad is that we're dying because of it. We're being lynched. And not much has changed. But what's the good? Well, I see the silver lining. There was a recent article by Darrell Gaskin and I think Thomas Levis that actually looked at the cost of these disparities, estimating that over $80 billion each year occurs because of health disparities. Now, I run a small independent physicians association. When I read that, I said, aha, nothing in this country means anything until you put a dollar sign to it. And the problem was it taking care of us, because of that 80 billion, guess who's costing the most? African Americans, over 54 billion. But now they can't avoid us in the system. And guess who is paying the most for that care? It's not CMS or the state, it's the private health insurers and the individuals who are insured. Now that's power. Why is that power? Because now they recognize that since they can't avoid this population, they now need to redirect their resources to develop what I call a business model to eliminate health disparities, simply by saying, if I spend $1 million up front to address the social barriers and the social issues of poor housing, poor economics, and some simple intervention techniques, I can probably save 5 or 10 million. And so I think we need to change the paradigm from immoral and continue that, but add what is the business model that will really force this country to address the issue with resources of the Ruby Matthewsons.
Let me call on now Dr. Shariki Kumanyika, who's a professor of epidemiology at the University of Pennsylvania. Doctor, what do you see, and what would you say to this audience about what needs to be our priorities? You see people after they're sick as opposed to before they get sick. What do you see, and what can we do to prevent some of these issues?
Thank you. And let me add how inspiring this whole experience is. It's really a privilege to be here. I want to talk about food as a social justice issue and bring the conversation to where I think it needs to be to motivate us to take some different types of actions. If I ask people what is food as a social justice issue, they'd probably say hunger. And hunger is very much still a problem in the United States and in the world. But I want to talk about the other side of the food equation, which is the fact that if African Americans, for example, were to eat in the way that my research, that epidemiologic research says would prolong life and keep people from having to come in to see Dr. Hood, maybe half of the disparities that we've heard about would not be there. So what's the problem? I learned a while ago that someone had documented what we've all observed, is that there are more liquor stores and there's more tobacco being sold in black communities. And I started wondering, I wonder if that applies to food, because I do see a lot of certain types of food being sold. It turns out that everything about the way food is marketed in this country comes together to push unhealthy food in our communities. Where the food is, we talk about the 4 P's of marketing. So the place, what kind of stores are there, the products, what kind of products are being promoted, the promotion itself, the advertising, and the price. So you can get unhealthy, cheap food close by, and every ad you see on TV, it's coming into your cell phone, it's on the side of the building, it may be written on the wall, and there may be one of your neighbors handing out leaflets about it. When I was reminded this morning that Dr. Sullivan stopped Uptown Cigarettes from selling their specially designed product in Philadelphia, where I live, I said, we can do this thing with food, but we have to first understand it. And this is where the problem is. Food may be the last palliative that we have that's legal, that doesn't kill you right away, that is a part of our love, our relationships. It affects children, so it's not like you're never too young to eat. You know, it's not like you have a legal limit on French fries or something like that. So if we could understand that this is a social justice issue in that the free market system allows people to sell whatever they want to an excess where they think they can sell it. So somebody thinks that we are a good market, a better market. Our kids are heavily targeted with soft drinks and unhealthy products. Somebody has decided that that's who we are, and it's called, segmentation, targeting, and positioning. So we're getting more of it, and we might be buying it because of all the other things you've heard about. See, it's a perfect storm. Because food does comfort, and it is something cheap you can afford, and you can give a treat to your child, and you can do that. We need to get above that and get food that serves the other purposes but doesn't kill us in the meantime. That's what we need to do.
Thank you so much. Let me go to Dr. Tina Young-Poussaint, Department of Radiology at Harvard, and ask you, you see every day, you're an expert, a scientist looking at all these slides, and what do they tell you? What do we have to worry about? And what is your advice to this audience?
Well, I think that one of the major things we have to try to do here in medicine is to try to be at the table, and we have small numbers in terms of setting policies and then prioritizing what we are interested in looking at. And I think until more people come into the positions of leadership, both in the government and in medical schools as deans, where where disparities are actually prioritized that affect underrepresented minorities, it may not be on the table. Before it was mentioned that about 12.6% of the population is African American. When you look at the number of graduates or practicing physicians, it's 6.8%. And when you actually look at people that are in positions, faculty positions, where they could have some way of implementing some of these things, there's only about 2.9% of faculty in the United States. Very small number of people that are deans. Some of the people that were on our panel earlier have been deans, but if we look at the number of deans and people in high positions of authority in the government who could try to prioritize some of the research, it doesn't exist. So I think this is one area. Who assigns the dollars in terms of the research and studying disparities is really, really needed. And in terms of cancer, if you look at this statistic, we have all these different cancers that exist. And if you look at the main cancers, lung cancer, breast cancer, prostate cancer, colon cancer, who are the people that are dying every day over the years? African Americans. And people haven't looked at studying these groups to determine what is happening, not only the environmental exposures or the late detection if you don't get to the doctor, but also the intrinsic differences that exist because we are African Americans in terms of molecular targets. For example, in breast cancer, they discovered that many African American women have the triple negative breast cancer. And where are we studying in these various cancer groups? What are the different molecular targets that are involved with African Americans? And if you look at the funding that is occurring in terms of research that is being implemented at NIH and that, if you look at investigators who are studying and doing research, a very small number of African American investigators have R01 grants. These are grants that are primary grants where you can study some specific thing that you want to study. We have not enough people even studying some of these things to help to understand why we have these high mortalities within the population. So I think that we still have to work on the pipeline, and we really have to hopefully become more in the positions to directing the dollars and making those decisions.
Thank you so much. Dr. Deborah Prothel-Stith, you've written 2 books now, and from the public health point of view about the crisis. And you said something in your first book, Dangerous Consequences, that, you know, instead of punishing, we should talk about treatment. Can you elaborate on that a little bit? Because people say, wait a minute, my son was killed by Jamal. Why should I talk about treatment for Jamal as opposed to punishing Jamal? You want to expand on that philosophy?
Sure. There is a lot to say, and Tree, first I just have to add my thanks to you for bringing this together. It is inspirational. The legends you honored are basically the mentors, the reason I'm in medicine and doing some of the things that I've done. And this awesome panel is just, thank you. It's just thank you. Yeah. I started thinking about the issue of violence as a health problem because of an experience in the emergency room when I was a student, and a young man that needed stitches after I put in the stitches told me not to go to bed because he was going to go out, get the guy who cut him, send him into the emergency room. And it was an immediate sort of laughter that we had as practitioners with him, followed by an immediate anger and disappointment. I realized at that moment that I was training in a profession to serve urban adolescents. That was my goal. And the leading cause of death was not addressed by the profession, and in fact, we were jokingly laughing with people even though we knew there was risk. We were stitching people up, sending them out, and it made me very angry. It, for me, set a course of trying to understand why we were stitching people up and sending them out. I understood that if someone had depression and made a suicide attempt and made a joke about going home to take some more pills, I definitely wouldn't have laughed with them. I had a protocol to prevent that behavior. And even with heart disease, we were trained to harass people who smoked, or, you know, they would be in the emergency room with a heart attack, but we'd talk about smoking and diet and all those things. And so it just really became very annoying to me that this behavioral issue was not much different from heart disease or lead poisoning, where we had to de-lead a house before the child left the hospital. But this issue of violence was treated differently. We didn't have a protocol. We didn't have a response. And fortunately, I found others in the country who were beginning to think about this issue differently. And the public health agenda really helped me understand how to deal with prevention, not just response. And there's a concept in public health of harm reduction. And I'm beginning to think a lot about that, in part because after the verdict in the Trayvon Martin case, I needed some harm reduction. I needed some help. I really was just stressed, as I'm sure everybody in here was as well. And fortunately for me, I went to church, and fortunately for me, we have this amazing young black male minister who had stayed up all night and wrote a litany that was being performed as I walked into church by hooded, hoodies, young black men in front of the congregation. And I won't read it, but if you'd like a copy, it's quite powerful. But the people say, "How do we sing today? How do we rejoice?" And a young black man in a hoodie answers by remembering the words of Elie Wiesel, and then the words are read.
And then the next is, how do we seek truth when justice is denied? And the next young black man in a hoodie read, by remembering the words of Martin Luther King, and then their words that are being read. And it was so healing for me at that time, and I sent it to family, and it just helped me understand in a very concrete way that while we have to work hard to make sure that the Trayvon Martin context never happens again, we know it will. And in our heart of hearts, we also have to work hard to do some harm reduction with our children. That the micro insults and the macro insults that they constantly experience have to be addressed, because those lead to the need for palliation, this whole notion that food is palliative. That leads to smoking and the relaxation that people get from smoking. We know how we handle those things in unhealthy ways. And I don't think we have paid enough attention to how we handle those things in healthy, sanctioned, acceptable ways. And as a parent, it's the thing that we all struggle to offer to our children, because we know they'll get into a classroom and the teacher is going to have very low expectations of them. How do you tell a child to deal with that? How do you tell a child to rise above that? You know they're going to go to a doctor who has unconscious bias and is in a system that has unconscious bias. How do we deal with that? How do we prepare them for that? The earlier panel talked about education, and that is really one of the ways that we can begin to offer not only our children, but in a much broader set, the nation's, not just African American children, because you know they're not the only ones who experience this, but the nation's children who are harmed by these micro and macro insults. How do we help them heal? And I realize that it's an area of work. The psychologist, the psychiatrist, Alvin, we need to talk about this. Tree, I need to talk to your wife about this. We started a little over lunch. But I think the next manual for our children, preventing heart disease, asthma, obviously this cycle of violence, has to get to that question. What are they supposed to do? What do we want them to do when it takes the ambulance 30 minutes to get there and their friend dies? If we cannot answer that question, then we haven't really stepped up to the plate. What are the healthy ways that we can handle these things? And I don't have the answers, but I really, based on this very personal response, and fortunately my pastor's litany, I'm open to embarking on this work because I think it underlies a lot of what we're talking about.
Great, thank you so much. Dr. David Satcher, first, thank you for being on both of these panels, and you have done an incredible job. I wanted to quote for you a sermon that my wife and others heard 2 weeks ago here at Union Chapel by another Morehouse man, John Wilson, who went to Morehouse as a student and now is the president of Morehouse. The name of his sermon was, "You Are Not Hungry," right? And he explained it that he was out playing and came in to get a sandwich, and his grandmother said, he wanted something to eat. She says, "No, you are not hungry." And so she gave him some water. And then he drank the water. He says, "Okay, I'm ready to eat now." She says, "No, you are thirsty." And gave him another glass of water. And he drank that glass of water and trying to figure that out. And the sense was, we are conditioned to be hungry and not conditioned to be thirsty, right? And so that's a sort of obvious thing, but how do you get people to understand that? We've heard all these ideas, they're wonderful ideas, but people still think they're hungry when the stomach is growling You know, when they haven't eaten, they want to eat, and they want to eat more and more and more. But how do we talk about health and health care, particularly to the John Wilsons, the next generation of young people who are coming up thinking that what I'm feeling is hunger, not thirst, and it's unhealthy, not healthy. How do we change that? Or can we?
Well, thank you, Tree. I'm delighted again to be a part of this very important program. I do want to say, however, before I respond to your question, how very inspired I was by the tribute to Harry Belafonte. I mean, now, I've been around a while. I've been around a while, and I have, throughout my life, you know, almost, I've been inspired by Harry's entertainment and leadership. But today I was inspired anew. I guess you don't get too old to be inspired by that kind of life. It reminded me of a motto that we have at the Satcher Health Leadership Institute at the Morehouse School of Medicine. We like to say that in order to eliminate disparities in health, we need leaders who first care enough. Then we need leaders who know enough. We need leaders who have the courage to do enough. And then we need leaders who will persevere until the job is done. Harry, I can think of nobody who demonstrates that more than you, and you have throughout your life, so thank you. Now, I think your question is really critical. I think it's an excellent one. It gets back to a lot of the things that have been discussed on this panel. And this is, by the way, the Surgeon General's prescription. Some of you are familiar with it. I first released it in 1999 when President Clinton asked me to represent the United States at a World Conference on Health Promotion and Disease Prevention. And I had been working on this prescription because when they told me, when I became Surgeon General, that I was the nation's doctor, I actually believed it. So I said, if I'm the nation's doctor, then I got to have a prescription for the nation. So the prescription starts off by saying that Americans should engage in moderate physical activity at least 5 days a week, 30 minutes a day. Then let me just finish it, then I'm gonna eat at least 5 servings of fruits and vegetables per day. 3, avoid toxins, including tobacco, illicit drugs, and the abuse of alcohol. 4, responsible sexual behavior, including abstinence where appropriate, and optimal protection when sexually active. And then finally, daily participation in relaxing and stress-reducing activities. That's the Surgeon General's prescription. There are no medications on here. These are all things that we can do for ourselves, beginning with physical activity. And since Dr. Kamanyika has done such a great job in talking about food, I want to just say a word about physical activity. I believe that physical activity is the most underutilized health intervention known to man. I really do. And, you know, I released the Surgeon General's report on overweight and obesity in December of 2001. And then I left the government in February of 2002. And one of the things that we did was to start this program, which some of you are familiar with, called Action for Healthy Kids. And we work with schools. We're trying to get the schools to return to physical education, K through 12, and to model good nutrition. But this is based on my response to your question, Charles. It is based on that good habits are as habituating as bad habits. In other words, you can become addicted, and I don't like to use that word necessarily, but it's true, addicted to good health habits, to regular physical activity, such that if you're not physically active, you're stressed, you're difficult to live with, as I am. If I miss my physical activity, I have to get up every morning and go out walking or jogging. The older I get, the slower it becomes. But seriously, we are trying to get the schools to help to habituate children to healthy lifestyles, especially regular physical activity and good nutrition. And we believe that you can do that. We're also trying to get parents to do that. I talked about our parenting program this morning, quality parenting. And it's been really, for me, you know, I have a leadership development program for physicians and other health professionals. We have a leadership development program for community health leaders. 8 pastors have gone through that program. But my favorite leadership development program is our quality parenting program. And I mentioned this morning, we just graduated 72 parents in June. We graduated 46 last year, and the program is growing. We're not experts in parenting, but we really care about parenting because we believe it can make the greatest difference in the lives of children, especially early child development. So another saying we have at our institute is that at the Satchel Health Leadership Institute, everybody teaches and everybody learns. So when we get together with parents in the community, 80% of whom are single parents, we start off by making it clear that we're there to not just share with them what we know about medicine and physical activity and good nutrition. We're there to learn together about what we can do together to improve parenting. And you would be amazed at the kind of things that they know, but they haven't been doing. But when they get together and they share with each other, what we've seen is a dramatic increase and improvement in quality parenting. We measure, as I said this morning, childhood obesity is one of the outcomes. We want to see that go down. We point out things like children who are breastfed are twice as likely not to be obese as children who are not breastfed. We also talk about the importance of in utero nutrition, starting with conception and all of the critical things that are involved in the brain developing normally. I was telling somebody yesterday that we are involved with the brain from conception to death. Many of you know that we've been working with former NFL players who suffered concussions while playing football and now are suffering from dementia. And we've seen suicide and divorce and family abuse related to this traumatic brain injury. We also see it in our soldiers coming back from Afghanistan. So protecting the brain has become a major focus of ours. But the most important way to help the brain is early childhood development. So I think what we're beginning to do is to get together on this point that the banging of heads must not be considered a sport, whether it's boxing or head-to-head contact in football. And I think that message is beginning to catch on. By the way, it also includes cheerleaders banging their head on the ground and getting concussions, which we don't think about. But we're having a conference in Washington in November about how do we protect our children who are involved with sports. We want them to be physically active. We want them to be involved in sports. We want them to develop lifetime habits of physical activity and good nutrition. But we want to protect them, especially protect their brains. So my response to your question, Tree, is that I think we have an opportunity to help our children develop lifetime habits of physical activity and good nutrition and other healthy lifestyle habits. I think we can do it. I think we've got to get together. I think parents are the most important, as Al Poussaint has said so many times. There is no substitute for quality parenting. But I think we can help. I think we're not helpless in the face of all of these problems. We can intervene. We can make a difference. We can learn from each other. I've been in leadership roles for the last 40 years, and what I tell our fellows when they come on board, or our community health leadership people, or the parents is, I am a student of leadership. We've got to continue to learn together, and if we do that, we can make progress in solving these problems. Thank you.
Thank you so much. Thank you so much. I'm going to try to have an interactive dialogue with the panelists, and all of you can, everybody's spoken already, can jump in anytime. You got your microphones, they're ready to roll. And then we're going to conclude, Mr. Belafonte, with Harry Belafonte. I'm going to come down and give him the microphone because he has a lot to say about health and health care. Are you booing yourself? But I just remember, this is about family, parenting, what parents can do, and what's realistic. We can say all these things, but I'm trying to figure out what's realistic. I remember my wife and I went out to California to visit relatives and visit my father. And our son was a toddler, had to be 4 years old. And we were having breakfast. and we didn't eat any pork at all. And my son, 4 years old, saw my father, his grandfather, eating pork. And he said, "Can I have some ham?" He couldn't say ham. "Can I have some ham?" And Pam and I said, "No." And my father said, "Get that boy some ham. You grew up on every part of the pig as a kid. You're healthy now. It's not going to hurt him." And so parenting is an issue. What do we need to do to talk to parents about that, parents, grandparents? Because if you think about what John Wilson was saying, it's a grandparent who said, "Look at me, I've lived to be 80. There's nothing wrong with eating these foods if you eat them right, and if you drink water, you don't have to worry about it." So what do we need to say directly, to parents, grandparents, and others, particularly single parents, in terms of what we have to do in this health issue? Yep. David?
I'm a grandparent, so I'm going to respond briefly. You know what we say as grandparents, that if we had known that grandchildren were going to be so much fun, we would have had them first. So I'm at that stage.
Right about that.
But I'm convinced that grandparents care deeply about their children and their grandchildren. And I think this whole issue of educating parents must include the grandparents. Now, we have grandparents in our program, many of them serving as parent leaders who help us with the parents, and we have to begin with them. We graduated 16 parent leaders in June. Many of them are grandparents, but they have met with us. They've talked about the impact of different kinds of foods, eating too much salt, eating too much sweets. And it's amazing how they change. So I do think you're right. I think we've got to educate everybody. But let me just say one other thing. We were talking about this at lunch. I think we underestimate the importance of portion size. We eat more in this country than any country I know of. And sometimes all we need to do is just cut back on the portion size. And you can get away with eating things if you don't eat too much of it without gaining weight and without it negatively impacting your health, because the body has the ability through the kidneys and the circulatory system to deal with a lot of things if we don't overwhelm it with too much.
Well, it's amazing as well. We're thinking about health. Everybody saw former President George W. Bush jogging, running, healthy, eating healthy food. All of a sudden he has to have a heart procedure, which means that you can't always see these silent and sometimes secret diseases that might have an impact.
Exactly.
Dr. Hood, anything you want to do? I'm sorry. Were you
I wanted to just sort of interject the parenting is probably the most difficult thing any of us has ever done. Even though we trained hard to do some other things, very little training for parenting actually takes place. I think the idea of middle school parenting or high school is important. But most of us are really kind of flying by the seat of our pants, particularly if we didn't have examples in our parents of how to do that thing that's so difficult well. And fortunately, some of us did, but we're still sort of flying by the seat of our pants. And there's the part of parenting that relates to the issue of violence as well. And it is, some have called it anticipatory guidance, but how is it that you plan to discipline your child, and how is it that you plan to help your child deal with bullies or with difficult situations? And again, I just think it's such an important and rich area, and we have to weave in those kinds of emotional skills with the nutrition and the physical activity, because it for us, not just for African Americans, but it for us is, just Dr. Williams, David talked about the aging, we're 10 years older. Chronologically we may be the same age, but physically our body is 10 years older than a white American counterpart. I think a lot of that has to do with stress and these micro insults and responding. I mean, the research on high blood pressure and other, and I just hope we can become very intentional about that, because being a black parent of a black boy in particular is, if you think parenting is difficult in this society where the forces are pulling that child toward jail or other kinds of really bad, and you are actively, energetically, daily, consistently, prayerfully trying to keep him out, it is, you know, it is a thing. It is a thing, and everybody needs help with that one.
I know Dr.
I think-
Hassan and Dr. Hood have something to say. Go
I
ahead.
think also there's really a need for education of what milestones are expected for children. There are so many people who do not, young people particularly, who are having children who don't know the normal milestones of development, who think that if the child is reaching or not obeying them at 1 year old, that they don't listening, they're not listening, and will discipline them. We have to also remember that the forms of discipline we use in 2013 should be different from whatever you grew up with in terms of physical abuse, and that when we physically abuse our children, this is what they're learning, is what people do in frustration and that type of thing. So I think there has to be education on the milestones. We have to become more cognizant about what children should know at certain ages. So many of our children go into the public school or the private school not knowing certain basic things, how to tell their colors, how to count. You wouldn't, it's unbelievable. They are not empowered, so they're at extremely low, a big disadvantage because of it.
Dr. Hood?
Yeah. First of all, I want to echo what was said, but I think the issue is education. What are we going to do? I think we really need to have our own schools. And my example goes back to, I'm happy to be here. I'm actually grew up in Roxbury, went to Boston Tech. When I grew up, I had an eclectic group of friends. One of them was this little Jewish kid who I used to play with. I don't know, maybe I was about 9, 10, 11. But on the weekends, he couldn't play. I forget whether it was Saturday or Sunday. I can't remember. So I'm inquisitive. I asked him, I said, well, what's happening? He said, I go to school. So I said, well, can I come? He said, I don't know. I have to ask my father. And he did, and sure enough, he came, and believe it or not, I was invited. And this was a weekend school for Jewish kids by Jews, not just teaching religion, but about culture, but about law, but about, I only got to go once. I tried to go again. I wasn't invited back. I don't know why. But we don't have that. We rely on the public schools to educate our children. And what I'm getting at is that the majority of the population we're talking about have poor parenting skills. Right. I'm supposed to have good parenting skills, but my children remind me all the time I probably needed to get an education in parenting, in a degree, because it is not something that we learn. So one of the things, there's a group of us actually in San Diego, one of the fraternities that I'm associated with, that are talking about trying to start a weekend school for African American children. So we can talk about education, but we need to do something, and I think that's a local issue, and the whole concept came from that experience with the Jewish community. Now, Deborah, I can't agree with you more. The microaggressions, the micro-insults are killing us. American culture is bad for our health. It's taken me a long time to realize that. And to me, that's where the research needs to be. There's nothing else, as far as I'm concerned, that will totally explain the high death rate within the African American community. And my first exposure, my mother, Lenox Street Projects, I was born at Boston City Hospital, and went there on a regular basis for my clinic care. And one time, I'm in a waiting room with my mother. And those of you who know Boston at that time, South Boston, East Boston, and whatnot, there were some interns. I don't know what university it was, but it was a long wait. Miss O'Donnell, and a lady would jump up and go in. Miss O'Connor, Miss Murphy, and finally, I hear my mother's name, and this young white resident, an intern, says, Evelyn. And I'm excited. So I jump up, and my mother grabs me, pulls me down, and I'm looking at her, and the resident intern keeps calling her Evelyn. So finally he comes up to her and says, Evelyn, you're next. She said, I did not give you permission to call me by my first name. Now, I left that event not really understanding what my mother was teaching me, because she never said anything else. But to this day, everyone in my office must refer to any elder by Mr. or Ms., never by their first time. Now, my mother also gave me permission to be paranoid. Because as a young kid, I came home from school and was called what I thought was a bad name. And my mother could always tell when I was upset. So she asked me what was wrong. So finally I said, well, somebody called me a name. She asked me what it was. And I said, paranoid. Well, she laughed. And as usual, she would make me go to the dictionary, read it, and I'm trying to understand, why is this kid calling me paranoid? And then my mother said, it is healthy for a young black man to be paranoid in this country. So, I believe we're being lynched.
Appreciate it. Now, everybody knows that Dr. Rodney Hood looks nothing like me. We're both black men. But I'm going to be quoted tomorrow, even right now on Twitter, as if I said that. Tea Party, I know I'm getting tweets right now. Ogletree, you are the racist, you're the so-and-so, so stand up for me, brother. Stand up for me. There you go. We have three people, Dr. Williams, we also have Angela Glover-Blackwell, and Dr. Kuminyaka are all wants to say something, so you guys will spin out in time. Did I get you? Yes. Okay, got you.
I want to build on what Dr. Hood said that I think is so important, and also come back to the parenting issue quickly. One is, you're absolutely right, Dr. Hood. About 18 years ago, I developed a scale called the Everyday Discrimination Scale that was trying to capture the daily indignities that we experience being black in America. And the scale has items like, in your day-to-day life, how often you're treated with less courtesy than others, how often you're treated with less respect than others, how often do people act like you're not smart, how often do people act like they're afraid of you, how often you receive poorer service in restaurants and stores. The 9-item scale can be administered in 2 minutes. We now have data from multiple studies. Dr. Tenny Lewis from Yale, now at Emory, has probably done the most work linking high levels on the everyday discrimination scale to physiological problems. We have documented the subclinical development of heart disease. There's a link with visceral fat, that's abdominal fat measured by a scan. We've linked it to increased mortality among African American elderly. So multiple mechanisms by which the stress of racism, so what happened to Trayvon Martin is happening to black people in slow motion all the time, every day, and it does build up and contribute to the racial disparities in health. So absolutely, that's true. And we also need, in parenting, to prepare our kids for that. One of the good things, there are a couple of recent studies that shows there are relatively simple things that parents and educators can do that can have a profound effect on building up the psychological well-being of African American students and dramatically improving their academic performance. It's so simple that I wouldn't believe it, except it's published in Science and randomized controlled trials. For those of you who don't know, that's the highest level of scientific evidence. What they do is take black, in one study, 7th and 8th graders in, and black and white. They did it with whites. It doesn't work for whites, no effect on whites. And they do this simple classroom exercise, asking them to think about what are their most important values, what determines who they really are, what kind of person you are. And you can talk about family or honesty or whatever value is important to you, and write about that value, why you selected it, and why it's important. It takes about 30 minutes to administer. That simple exercise, which is designed to build the self-worth and positive feelings of that person as an individual, has been shown to reduce the black-white gap in academic performance in all classes, not just the class in which it was taken, but in all classes, by 40%. The effect is maintained 2 years later. There are less students going into remedial programs, less kids dropping out of school just from this exercise. They've tried, if you do it more than once, one dose is enough to produce the effect. Similarly, they found that among African American college students, this was done at Stanford University, a lot of kids, as they first generation college encounter difficulties, believe that the problems that they face reinforces the notion that they don't belong here. That's why they're struggling, and they believe that everybody else is doing well. So they developed this intervention by Walton, did it, called the social belonging intervention. Brings the kids in as freshmen, tells them there's a lot of new research that shows everybody has problems in college, but it gets better over time. So they normalize it, it happens to everybody, it gets better over time. And to help the kids internalize it, they said, we want you to share this information with future students, so we want to tape you. You need to learn it and say it convincingly, and we'll videotape you so that future students will share it with. They tracked the kids as seniors. Those who got the intervention, experimental study with compared to a control group, higher grades throughout their 4 years of college. Better mental health throughout their 4 years of college. More likely to graduate. So dramatic effects on their academic performance, and they ask the kids if they remember what they did in the freshman year. They don't really have a specific recollection of it. So there are relatively simple things we can begin to do that can have a huge impact on building the self-esteem, building the self-worth, and I think the weekend colleges for high schools is part of that, that parents and teachers and persons in the community, because it still takes a village to raise our kids, and we all need to recognize our responsibility to build up our kids.
Thank you very much. I'm going to Angela Glover Blackwell and then to Dr. Kumanyika.
Thank you. Thank you for the conversation. It really is so important. And the things that we're talking about are deeply important for the health and well-being for the nation, as well as for our children and families. We must focus on parenting. We must focus on the resilience of children themselves. And we need to understand that the whole community can be helpful in helping the families and the children in community do better. But we don't have time to do this family by family and child by child. We just don't, which is why I keep coming back to public policy, not as a replacement for the things that we're talking about. We must do these things. And at the same time, we have to understand that many people, and I'm one of them, I think that one of the most important public policies of the 20th century was the National Highway Act. The National Highway Act, because that's what built the middle class, the houses, the roads, the automobile industry. When I was in college, the kids who were middle class were kids from Detroit. Their parents weren't college educated, but they had worked in the automobile industry. The National Highway Act did that because the country felt that it was important to do it, and it put a high priority on it. If the country understands its future, it will feel some urgency and come up with something like the National Highway Act to increase opportunity. Now, let me tell you what I mean. That by 2043, we become a nation in which the majority of people of color, Latino, African American, Asian, Native American, there is not one issue that has to do with the future of the nation, whether we're talking about leadership on the world stage, economic competitiveness in the global economy, education and being ready for the innovations that we need, that is not totally dependent on what happens to the people who are emerging as the future. Our health as a nation depends on that too. When we look at how we're falling, part of the reason that we're falling in terms of health status globally is because we are failing to invest in the health and well-being of people who are becoming the majority. So we know the things that are necessary. We know that one of the biggest predictors of your health and well-being is your economic status. So raising the minimum wage becomes an important health intervention. We know that one of the most important things in terms of health and well-being is starting school ready to learn and being able to do a good job in school and go on and reach your full potential. A universal early childhood program, or a targeted one on children who need it most, becomes a health intervention. So I just want us, as we're thinking about resilience and personal responsibility, to also think about the fact that we have to put everything we're doing on speed up, because the future, ours and the nation's, depends on how well we do around the very people, African Americans, Latinos, Native Americans, many Asian groups that are being disproportionately left behind. And the things that we need to do to compete as a nation are the things that we need to do to improve the quality of life for people who are being left behind and to achieve equity. I say that equity is really the superior growth model for the future.
Great, great. Let me say, before I go to Dr. Kumanyika, what would you say to President Obama about policy? What does he need to do? We've got the Affordable Care Act. Some people say that it has some benefits. We'll talk about that a little bit. But what does he need to do? He has 2.5 years left. What would your message be to him?
There's some things that he's doing that he needs to absolutely continue and make sure his administration does a drill down on them. For example, in the Affordable Care Act, there are a lot of opportunities to deal with the economic problems. For example, the Affordable Care Act allows for more focus on physician assistance, more focus on people in community to help to do that kind of prevention work. Physician assistance is a job that actually pays good wages. It's important for health, and they're starting to pull the training for it out of community colleges and put it into four-year institutions, taking it away from the young people, black and brown, who need it. We need to make sure that we're focusing the economic parts of the Affordable Care Act on communities that need it. The president needs to push harder on the infrastructure work that he has talked about all along. You invest in infrastructure, you create jobs. You target those jobs for low-income people in low-income communities. You improve the economic well-being of communities. That improves health. We need to stop talking about a little bit of increase in the minimum wage. We need a big increase in the minimum wage. Families that go to work every day should not be poor. It's not good for the economy. It's not good for community. It's not good for them. And the last thing I would say is to encourage the president to keep focusing on what they call within the administration their place-based initiatives. Those initiatives that improve the quality of life and opportunity in low-income communities, so that things like the Harlem Children's Zone being realized through Promise Neighborhoods expands. Things like Choice Neighborhoods out of HUD that's putting housing and transportation close together so families can have access to health care, recreational opportunities, and that we really take things like sustainable communities, thinking about economic development, the environment, all together so that we improve the environment and the quality of life. All of those things would make a huge difference, but we can't nickel and dime them. The times demand big investment, fast investment, and acknowledgement that while the moral imperative remains, and I embrace it totally, we also have an economic and a national imperative to do the thing that we failed to do for way too long.
Great. We got Dr. Kumanyika, then we got Dr. Satcher, and we're going to go back to both Deborah Prothel-Stitt and also to Mona Lisa Smith.
Thank you. I have 2 points that I'm going to say them both now in case I don't get another turn. One has to do with the grandparenting generation, and whether we could think more about what the older generation could be doing. My sense from listening and from my own experience is that we're still trying to protect ourselves in the environment, and we're using survival skills and knowledge from our generation to try to mentor our children or our grandchildren. And I think we need a better analysis. We need to catch up, because the survival skills that we need, including food issues, that's just an example, because the survival used to mean, pushing that meat in and doing the things that were, the dietary guidelines have totally flipped over from what they were when I was born. And so if people are using their historical experiences and knowledge and the accommodations that were developed to survive, we are never going to get there, because we'll be going backwards. We need new skills now. And I think that the older generation among ourselves need to have a conversation that then trickles down to the younger generations about what survival means, and that we need to get on board with that. So I just wanted to make that observation. The other has to do with businesses that have the interests of the Black community at heart. it's perhaps the answer to this is to integrate the discourse among a lot of fields, including business and humanities and social sciences. You know, in public health, we call it health in all policies. But I'm thinking about bringing all the disciplines together, because the discourse about race and survival and people moving up the ladder, well, who are the executives that are telling companies how to be predatory when it comes? There's a lot of black executives out there who've made it by delivering us, you know, into the canon. So I think that we need to create a dialogue that incentivizes businesses to think, how can we make money with black people, not on the backs of black people in terms of these products, and bring the business model into the game, because it's like you said, you know, we need our own schools, we need our own businesses to have our interests at heart. And I can't figure out why the dominant culture is taking away the people who are smart in business and having them turn against us, because it's so easy to sell things that are not good for people. So I just wanted to bring that in, maybe a more transdisciplinary look at this issue, and bringing in the private sector on our side.
Let me ask you one question about that before going to Dr. Satcher about that. If you remember, Carolyn Butts had this campaign against selling alcohol, liquor all around the black community, and very effective in that sense. There was a protest. So the question is, what should we do other than talk about policy? Should we be doing, should churches be doing things? Should we be doing things? Because these meetings may or may not happen. They may not end in any change. I'm thinking this is 2013. It's 50 years after Brown. And you expect that as it comes up in a week, we're going to be celebrating how much progress we made. We have made progress, but there's a whole shadow of black folks below us who've made no progress. In many respects, the situation is worse. And I wonder if, have we forgotten, and Dr. Williams, tell me no, I hope, and David Satcher, have we forgotten that we have done well? We are at these universities, we're at these corporations, we are CEOs, we are President of the United States, we're senators. But behind us is a litany of young African-American boys in particular, but boys and girls and single parents in the 21st century. It doesn't look like we've made the progress as a group of people of African descent together. We made it separately. Dr. Satcher?
Yeah, I was going to be brief. I was going to comment on Dr. Blackwell's comment, but I will respond to that too. I think the point that Dr. Blackwell made about policy is so critical, because I think, as the World Health Organization said in the social determinants of health, the way you change the social determinants of health ideally is through policy. You got to have the right policies in place. And our program that I mentioned, the Quality Parenting Program, is run by Dr. Martha Okafor, who is a behavioral scientist and anthropologist. And she, as Dr. Poussaint was saying, she deals with all these landmarks, you know, where should children be doing it? And that's good. And one other thing, the National Institute for Minority Health and Health Disparities, Dr. Sullivan helped to get legislation passed for that. That's the only institute at NIH I know that's funding the health policy issues related to disparities in health. It is it's a program within that institute, and we have at the Morehouse School of Medicine, we have one of the health policy institutes. And this parenting program is under that, and the goal is to demonstrate the impact of quality parenting on health outcomes. So, childhood obesity, child behavior, child learning, meeting the landmarks, all of these things are measured. And interestingly enough, the parents themselves suggested to us that we needed to be measuring what's happening to them, not just the children. And our first measures showed that among these parents, there was a decline in depression. That the parents who participated in that program were most like, and you know, depression has been going up among black women, and 90% of these parents, by the way, are black. So depression is going down in that population. And when you think about it, it makes sense. They have this social network, they're working with each other, they are feeling better about themselves as parents. So we see less depression in that population. But last year, NIH agreed to fund us to replicate this program in 13 states. Just getting back to policy, but ultimately what we want is what Dr. Blackwell and Dr. Kamenyika suggested. We want national policy that assures that there are programs to support parents in all of these communities. And you know, we've been that route a little bit before. Robert Johnson Foundation once had a program, 0 to 3, which tried to show that that was the best time to intervene for children's learning. But then the government wouldn't fund it once the foundation, you know, stopped funding it. So I agree. I think the ultimate goal is to change policies so that policies support the kind of thing that David was talking about and that we're suggesting here. We need changes in policy that will affect all children, not just those in the communities where we happen to be able to work.
Thank you. Dr. Williams, are we ready to talk about us as opposed to them? That is the separation of the African-American community. We've made it, a lot of people haven't. How do we have that dialogue from your point of view, work you're doing?
It's both us and them. So that if we are going to be successful, I think Angela is completely right. I mean, we sometimes get involved in debates that are not helpful of whether it's personal responsibility or whether it's public policy. Folks, it's both. If we're going to be successful, it's one coin that has two sides. And of course, everyone has to make the right choices, but there is a social responsibility to create the opportunity and remove the barriers for people who live in places where the right choice isn't really available. So we need to have both. And coming to the point of the role of public policy and what I think is the real big problem, I go back to W.E.B. Du Bois. In 1899, he wrote a book called The Philadelphia Negro. And in that book, there's a chapter on Negro health. And this is what he said about health disparities in 1899 that I think is still true today. He says, the most difficult social problem with the matter of Negro health is the peculiar attitude of the nation towards the well-being of the race. And Du Bois continued, there are few other cases in the history of civilized peoples where human suffering has been viewed with such peculiar indifference. Researchers today call it the empathy gap. In the American electorate, there is less sympathy for anything, any initiative that political scientists have studied having to do with helping black people. That is the reality of where the American populace is. We are a generous people. There's an earthquake in Haiti. We respond with love and donations. And it's not an impossible situation, but we need to work with communication experts and with political scientists and psychologists to identify how can we tell the story in a way that connects emotionally with the American public so that they will be, because of the emotional connection, will be motivated to act and to enact the kinds of public policies that Angela is talking about that are necessary to make a difference for the lives of black Americans.
Thanks so much, appreciate it. Our last three sets of comments, Dr. Deborah Prothero-Stith, Dr. Rodney Hood, and then Mona Lisa Smith will have the final word.
So, as I said, there's a lot to say, but I really think one aspect of not only the two sides of the same coin is connecting the public policy work to the individual responsibility work, because when you start doing that, you realize that a lot of the individuals that are empowered by some of that work become the leaders who help set the stage for changes in public policy. So it's both, and I think there's some synergy between those sets of activities that we can get more. I mean, teaching violence prevention in the classroom, there was always one or two students that I saw that I knew could be the Martin Luther King of nonviolence for interpersonal relationships, just because of the power with which they changed and embraced what was going on. And I think there's some ways, Angela, to get some of those mothers, some of those, residents of public housing just at the table, empowered with the information. And survivors of violence, I'm glad you're going next, Mona. Really, Mona Lisa captures for me a lot of the real potential to make the changes. And they remind me of Mothers Against Drunk Driving, who had very significant public policy legislative changes. They changed the practices of professions across the country and the power that's there around this issue of violence. So doctors can't stitch kids up and send them out. That's malpractice. That's on your plate, but we're gonna help. But the power of the individual who got the information, who can help us move forward on the policy piece is just there. And the last thing I'll say is that the public schools are up for grabs. And right now, we have resigned them to the fight between the union and the mayor or whomever is in charge of the budget. And I'll ask everyone in here to consider a trip to your local public school. Just consider a trip there. Because when eyes are watching, they get better. When there is a volunteer in the classroom, they get better. And once we get there, I look at what's happening in the courts and how there's a new court in almost every community, that we do jury duty, so we all are in there all the time and we're watching it on television. If we were in the public schools all the time, we'd have some new schools, we'd have some new libraries, because we know the public policy issues that are so apparent when you walk in and you see that there is a 18-minute lunch and no art and no music and no physical education. So we've got a public policy agenda, and I think there are some people who can lead us through that. And I'm going to throw it to Mona Lisa, because I know, is she next?
No, she's after Dr. Hood.
Oh, okay, sorry.
Dr. Hood?
Thank you.
Very briefly, talking about policy. One of my passions is, how do you take policy and how do you take research and intersect it with something practical that is actually helping patients? And what I found as part of the Affordable Care Act is the new CMMI Center, the Innovation Center, which was created to stimulate innovative programs for the country as a whole, but specifically for underserved populations. Now, I run an independent physicians association called the Multicultural IPA. We were fortunate enough to receive one of these CMMI grants. And basically, it's funding $1 million over 3 years, in which I was able to put together an intervention team. It's a nurse case manager, it's a social worker, and community volunteers, key, working with, I don't know if you've ever heard of PICO, who has a chapter in San Diego. The concept of hotspotting started by Jeffrey Brenner out of Camden, and he saved a lot of money. I think the first high-utilizing patients that he identified were utilizing $1.5 million a month. After the intervention, he cut that to less than $500,000. And so CMS, who was spending all this money, said, we want to see if we can replicate that. Well, there were 4 other centers. One of them is San Diego that I have. After 1 year, we've enrolled 50 patients. One of the first patients I enrolled was Ruby Mathewson, you heard me speak of. And she had been utilizing the hospital 2 to 3 times a month, ER multiple times. Once when we put together this intervention team, she's in the past 6 months only been hospitalized once. Now, I like to think I'm a good physician. She was seeing me on a regular basis. So what I've learned from that is it's really not about the physician. It's really about bringing a team approach. This team is now located in my office. And it's not just for my patients, it's other patients that are high utilizers in that particular area. And what I've learned from that is that you need to, A, empower the community, put it at the community level, and it's really going to take that community intervention. And the reason why she got better wasn't because of clinical indicators, but it was because of dealing with the social barriers. Her income, I think she was making $1,100. She was in a hotel costing $950. Her medicines and other expenses cost about $500. And simply having the social worker find her other resources, help her find a better place to live, doing medication reconciliation, mostly done by the team, not by me, was able to keep this patient out of the hospital. So the Innovation Center, as part of the ACC, that needs to be duplicated, because I totally agree with the food justice, with the children, which needs to be the focus. But millions of folks out there now, like Ruby is saying, who's going to help me?
Final words, go ahead, Mona Lisa.
I guess I would just add everything that we heard today. I'm sure that everyone in the community, from a mother to a survivor to a father who is dealing with our crisis every day, would concur and say that's exactly what we need to do. Public policy, schools for our children. We need to start to deal with, some of the disparities and how we see ourselves as a community. But we also need a renewed sense of community. We need to start to break down some of those things that are hindering us from trusting one another. If I'm a mother and dealing with those realities of raising a brown or black boy or girl, then I need to be able to trust the community around me, that I have a resource, that I could go to another mother, another woman, and really begin to share and begin to know, how am I going to navigate through those systems? That if I'm having a problem with my public school, that I don't have to be fearful that someone's going to intervene and try to take my child away from me because I'm challenging a system that's faulty. I think we have to really begin to get deeper into this sense of community and really begin to not redefine it, but teach it to ourselves, and begin to look inward at some of the things that we may be doing that causes our young people to maybe feel bad about themselves, our body language, our reaction to them, the way we think about different things, and then begin to come up with the plan. And the plan has to be an urgency for now, because every day we talk about it, we continue to lose our children. Have community forums. We teach about, identity and who are we, looking at ourselves from what are the common bonds that we do. We look at cultural biases and discrimination, and when we're creating visions for ourselves, because many of us have lost those visions, and we look at those not in the sense of that being a negative, but we need to understand, what does society say about me, an aunt that lost her nephew to violence, and he was a black boy? Why do they think that he was involved in drugs? Why do they think that it was because his pants were hanging down? Because somebody doesn't go to school? Why do they think they just don't go to school? Because they don't want to. Why isn't it because they're afraid to go? Because the people in the school cause them harm. So these are types of things that we just have to come down deeper and begin to talk about within our community, and rebuild that sense of community that we so need in order to keep fighting the good fight.
Thank you. Please thank all of our panelists. And we're about to end now. I just wanted to thank all of you, and you all will be getting gifts from us. We're going to mail them to you, including this wonderful poster that is autographed by all of you and Larry Watson, the singer. And if you're really good, we might even get it signed by Harry Belafonte. Don't tell him I said that.